Welcome to this labour and birth preparation session. This session is aimed at those who are planning a vaginal birth after previously having a caesarean birth. VBAC, vaginal birth after caesarean. The recommendations for care in labour include birth in a labour ward with access to emergency care and for continuous monitoring of baby's heartbeat in labour. Statistics suggest successful VBAC is around 40 to 95%, depending on your risk factors. So what can you do to prepare? It's important to seek knowledge. By reading about pregnancy and birth, you can book a tour of our maternity unit. It's important to take regular exercise. Keeping active during pregnancy will help you for your birth. You can practice meditation and breathing techniques, such as mindfulness, regular relaxation and/or hypnobirthing. These will help you both during your pregnancy and birth. You can start thinking about your birth preferences. You can jot these down in your antenatal notes. There are prompts to promote thoughts around choice during labour and birth. You can discuss this with your birth partner, but remember to stay open-minded as plans can change. You can attend antenatal groups to access peer support, speak to your family, friends and other pregnant people and your midwife. You could start listening to playlists or audiobooks, sounds that you might find comforting or distracting during labour. So what should you do if you think your labour is starting? If you think you may be in labour, you should always call us on the maternity triage line. This number can be found on the front of your notes. It's important to call us if you feel worried or concerned about anything related to your pregnancy, or if you think you're in labour. We would prefer to speak to you in person so we can provide individualised advice. Some signs of labour are regular contractions. You may have backache, your waters may break, or you may have a show, also known as the mucus plug. Some really important signs where you should always contact us is if you notice a change in your baby's movements, you have any vaginal bleeding, scar pain, or you have a continuous pain that feels different and doesn't go away with pain relief. So what can you do to improve your comfort during early labour, either at home or in the hospital? You can have cuddles with your partner or loved one. This can increase the release of oxytocin, which is also known as the love hormone and is responsible for labour and contractions. You could have a bath or a shower. The use of water can be really comforting. It's important to maintain your energy by eating little and often. High energy foods. Consider packing snacks for the hospital. It's important to stay hydrated. You can drink water or isotonic drinks. Just be mindful if you have diabetes, you should consult your midwife on this. You should be passing urine normal amounts and normal colour. Ensure you empty your bladder every couple of hours. You can practice meditation, mindfulness, hypnobirthing techniques, which may help you to stay focused and calm. You can use a birthing ball, which is really good to optimise your baby's positioning. Being upright and active is really good for labour and birth. It's important to also rest. Listen to your body. If you feel tired, create a safe, comfortable space to rest in early labour between contractions. Lastly, you could always hire or buy a TENS machine. This is best when used in early labour and is really good if you have backache. So what pain relief options are available to you once you're in hospital? So firstly, we have Oromorph, which is a liquid morphine syrup that you can drink. This can be used in early labour. We have the use of water. We have a birthing pool available on our labour ward for use for birthing people with additional risk factors. We have Entonox. Entonox is a mixture of a gas called nitrous oxide and oxygen. It's also known as gas and air. You can breathe this in and out through a mouthpiece. Entonox is quick to work and the effects wear off in minutes. So therefore you can control how much pain relief you have. We then have Pethidine. Pethidine is an opioid drug that is given by injection to help with the pain. In labour, it usually lasts 3 to 4 hours. It can sometimes make you feel drowsy and sick, but we give you an anti-sickness medication to help with this. Finally, we have an epidural. This is a procedure done by an anaesthetist who inserts an epidural catheter into the lower part of your back to deliver continuous painkillers throughout your labour. This is the most effective form of an analgesia, but can lead to an increase in the need for assisted birth by forceps or ventouse. Here are some photos of our birthing environments on our labour ward. You are welcome to personalise your birth space with battery-powered lights, Bluetooth speaker to listen to your own music, your birth affirmations. You are welcome to bring your own pillows, snacks and drinks too. There is further information available via the QR code on this page for more detailed information about anaesthetics for birth, including epidural, spinal, caesarean birth and recovery. The information on this site is also available in multiple languages. Monitoring your baby's heartbeat in labour. The National Institute of Clinical Excellence, NICE, recommends that we offer continuous CTG monitoring for women in labour who have any antenatal maternal risk factors, to include previous caesarean birth. This would have been discussed during your birth choices appointment. Continuous electronic fetal heart rate monitoring is performed using external leads which are held in place by two soft belts around your bump to enable assessment of your baby's well-being. The photo shows the monitor being attached while you are sitting. Once it is connected, you can mobilise within range of the monitor. If you are keen to use the birth pool during labour, speak to your midwife about the use of a wireless monitor which can be used if available. Occasionally, there may be difficulty in continuously recording your baby's heartbeat. In these situations, it may be recommended to use a fetal scalp electrode to ensure we are able to continue close monitoring of your baby's well-being throughout your labour. This will also enable you to be able to remain mobile. Moving around, staying upright and changing position in labour can help ease the pain, help you cope, make you feel more in control of your labour, increase your chances of a shorter labour, help push the baby downwards, and help you find the best position for giving birth. It is beneficial to include your birth partner in finding out about and supporting you during active birth. There is a QR code that takes you to an active birth video, which is also on our website. The third stage of labour is the period after your baby has been born, up until the expulsion of your placenta and membranes. Your midwife is likely to ask you how you wish to manage this stage of labour. This management is usually described as an active third stage or a physiological third stage, and the table on this slide is designed to show you the comparison between these. There may be times when active management is advised due to medical reasons. For example, if you have had a previous birth with a blood loss of over 500 ml. Please take a moment to read this slide. So what is an assisted birth? Approximately 1 in 8 babies are born by assisted vaginal birth. The chance of requiring assistance for birth is higher in those who have an epidural and for women having their first vaginal birth. Assisted birth is when an obstetrician helps you with the birth of your baby while you continue to push by either using a ventouse, which is a plastic or metal suction cup that is placed on your baby's head, or forceps, our smooth metal curved instrument which is placed on both sides of your baby's head. They are also sometimes used at caesarean births to help baby be born. It may be necessary to perform an episiotomy, which is a cut to the perineum, if an assisted birth is necessary to prevent additional trauma. Any perineal trauma will be repaired immediately after birth with dissolvable stitches. Your midwife will advise you on caring for perineal tears after your birth. So let's talk a little bit about unplanned caesarean birth. Birth is unpredictable at the end of the day. In 2022, approximately 18% of our babies were born by unplanned caesarean at SASH. The midwife who cares for you in labour will accompany you to theatre. She will know your birth preferences and advocate for these. One birth partner can come with you to theatre, providing you do not require a general anaesthetic. Most unplanned caesareans are done while you're awake, with a spinal or epidural top-up. It is usual for there to be approximately 10 people in theatre. This is necessary to provide you with the safest care. The photo on the left is a picture of Mum's view from our theatre bed. Your birth partner will be sitting next to you. If your baby needs any support following your birth, this will also be next to you in theatre. Our aim is to keep you as a family. Once you leave theatre, you will be cared for by your midwife in our maternity recovery area. There's a picture on the right of this screen. During this time, you can continue skin to skin with your baby and initiate feeding. Your midwife will complete any important birth documentation during this time. Skin to skin contact is encouraged for all mothers post-birth, however babies are born. It can help to regulate temperature, heart rate and breathing, colonize baby with healthy good bacteria, which is beneficial for growth and natural immunity. It induces a sense of calmness and well-being in both you and your baby. It can promote feeding behaviours in your baby, whether breast or bottle fed. It promotes oxytocin and prolactin release, crucial hormones in milk production and bonding. Induction of labour when planning your VBAC. If you are overdue, NICE guidance recommends birth by 41 weeks of pregnancy. At SASH, we now offer induction at 40+5. There may be other medical indications requiring an induction of labour. Your obstetrician will discuss these with you on an individual basis. However, the method of induction will remain the same. Induction of labour may be assisted using a non-hormonal method called Diazepam to help you achieve a VBAC. It may be possible to break the bag of waters around your baby. The use of a hormone drip may be considered to stimulate contractions. This will be monitored carefully due to the increased risk of scar rupture in VBAC. You may decide that induction is not right for you or is not recommended, and in this event you may choose to opt for a planned caesarean birth instead. Please scan the QR codes for further information on induction of labour. If your plan for vaginal birth changes during your pregnancy due to your personal preference or due to new medical concerns, you may choose for a planned caesarean birth. You will get to meet with our evergreen team of midwives who care for you during your planned caesarean birth. Your postnatal stay after birth may vary depending on how your baby is born and whether you or your baby have any medical conditions that require monitoring in hospital. If you have a vaginal birth with no other indications to stay in hospital, you could be discharged home 6 to 8 hours post-birth. If you have a caesarean, the national recommendation is to remain in hospital for at least 24 hours for close observation. You can speak to your midwife regarding the following: visiting, length of your stay, infant feeding, discharge process, newborn examination, and going home. We wish you all the best with your pregnancy and hope you feel more informed to achieve a positive birth. Thank you for listening.